Hi, Casey.
Hello.
We want to talk to you today about the clinic that you are part of in the Affordable Senior Housing Project right near VCU, Virginia Commonwealth University. How do they actually help the students, and what's the real contribution of that to their professional development and to their education?
Our program takes students from nursing, pharmacy, social work, and medicine, puts them in real life situations as they're learning to work together in teams so that when they go out into practice, they know, well, I can look to the social worker for these aspects or these parts of care, and I can look to the pharmacist for medication management so that they get a sense that they're not all knowing and it's okay to ask questions of other professionals that have special expertise. And then more importantly, it provides a venue for modeling. So we have faculty members from each school modeling teamwork and modeling how they interact with each other so that students can also learn from that expertise and experience as well. So it's really an immersive experience that takes students out of their comfort zones, but forces them to interact in a way that they're traditionally not taught or work within.
That's great. Can we drill down a little bit more to an issue that I know is really important to you as a pharmacist, and that is this whole issue of medication management?
You're absolutely right. So these folks, these seniors, have a lot of medications. They have a lot of providers, and many times their providers are not able to communicate with each other. So we really focus on the care coordination aspects as it relates to medication management. So providing a venue for residents to seek us out and ask questions about their medications. When they come back from a hospital or from a recent discharge, to get them up to speed on what they should be doing with their old medications versus their new medications, preventing drug interactions, also looking at non adherence. Why aren't they taking their medications? Many times it's not that the resident doesn't want to take the medication, they may actually lack access to the medication. So we've implemented programs with some of our independent pharmacies in the area to deliver medications while we're on site, allowing students to counsel the residents about their new medications, reinforce some of the key concepts, and then check up with them on a weekly basis to ensure that they're taking their medications, they're actually receiving benefit, and they're not experiencing adverse effects.
Let's talk a little bit about the real importance and the real benefit of the housing property itself. The relationship with the service coordinator who is on site at the property, I know, is a really important piece of your team and sort of creating the success that you have had there. Can you talk a little bit about how you work with the service coordinator in the property?
Sure. So Greg Ford at Dominion Place has been the key to our success. He's the reason why we're able to do the things that we're currently doing. Greg enables us to identify key resources. He's really the eyes and ears on the ground. He's the person that is seeing what the residents are experiencing day to day. He's the one that is able to identify at-risk residents and encourage them to come see us on a weekly basis. So working with him is key. He allows the residents to seek us out for needed healthcare services. He allows us to provide additional education around topics that he's seeing within the community. So the reciprocal nature of our partnership has really worked well because he informs our decision making as well as we provide things or bring things to the table that may benefit the community. And before we interact or implement something new, it's always a discussion back and forth. And community engagement is always that reciprocal relationship. And what we try to do is make sure Greg's always at the table as the resident service coordinator in anything we do moving forward, because he's going to really put the brakes on if necessary or tell us or encourage us we need to go more in this direction. We would be naive to think that we know what the community needs best. And Greg is our main liaison to determine what's appropriate for that community.
That's great. I don't know whether you can answer this, but one of the things that everybody is really interested in is whether this model, this kind of a program that brings a clinic on site for low-income seniors, really makes a difference in healthcare utilizations.
Yes, we have seen a difference. In 2012, right before we implemented the program, the local ambulance authority noted that there were about 153 emergency room transports from that local address at Dominion Place. And they deemed 100 or classified 151 of those transports to be not emergent. So we have a community or a housing building that is frequent utilizers of the healthcare system and maybe not utilizing it in the way that we would like or the way that's most appropriate. So since implementation of the program, we're currently working on our figures now for the end of the year, but we have seen a decrease in those non-emergent ER visits. So rather than the residents saying, I have a common cold, or I think I may have the flu, or I have some type of ailment, they'll come and see us in the wellness clinic first and let us to appropriately triage them to say, well, maybe you should see your primary care doctor rather than going to the emergency room. So that's worked out very well, and the residents feel very comfortable coming down to us and asking us what's most appropriate for the symptoms that I'm currently showing.
Thank you so much, Casey, and have a great time there. We love your program at VCU.
Thank you for having me.